As a co-chair of the Congressional Caucus on Foster Youth, I am privileged to be able to fight for foster youth, including meeting youth who have lived experience in the foster care system. It's no secret that many youth who age out of foster care experience homelessness. In fact, research shows that up to 46% of youth exiting foster care experience homelessness by age 26. That's thousands of individuals, young people without stable and consistent roofs over their head. This is unacceptable and entirely preventable. This bill, the Foster Youth Housing Opportunity Act, would be a good first step in helping to right this ship. By requiring state child welfare agencies to collaborate with public housing entities that administer programs specifically designed for foster youth, we can begin to bridge the gap in housing services for youth transitioning out of care and reduce homelessness rates amongst former foster youth. This bill also exempts so-called housing supportive services, such as security deposits and utility connection fees from the 30% housing cap under Chafee. This will allow states the opportunity to provide more youth with rental and housing assistance. We know that stable housing is the key to success, safety, and improved health outcomes. Without housing stability, it's nearly impossible to hold stable employment, address physical and mental health concerns, and maintain supportive relationships. We owe it to these young people to ensure that they have the tools that they need, not just to survive, but to thrive in adulthood. And that starts with safe, accessible, and affordable housing. Passing this bill is the first good step in ensuring that no foster youth is left to fend for themselves on the streets. And I want to join Mr. Kerry and all others who recognize the leadership that the First Lady, Mrs. Melania Trump, has lent to these initiatives. And hopefully that will mean that we will be able to fund some of these initiatives that we are now voting on today. Again, I'm the co-chair of the Congressional Caucus on Foster Youth, and I've had the privilege to interact with youth who have been very resilient, but they have just barely survived the foster care system. And I just want to lift them up today for teaching us so many things. One thing that I heard time and time again was how isolating and lonely aging out of foster care can be. I've shared a little bit about my own lived experience, and I can tell you that turning 18, not living with your mom or dad, having a baby is quite frankly terrifying. And youth who are aging out oftentimes are unable to achieve permanency with the foster or adoptive family, kinship caregivers, or even their own biological families through no fault of their own. This in turn leaves them without a trusted adult in their lives to help them navigate the complexities of transitioning to adulthood. I've said it before and I'll say it again. You do not magically become an adult at age 18. I personally have had the intervention of adults in my life that helped me navigate my way into college, helped me find housing, before there ever was a Chafee bill. And so this is so needed. You know, your 18th birthday is a celebration for most people, but there's no magic wand that makes you an adult. It really does take the guidance and mentorship of a trusted adult, which many of us had in our parents. But many of these youth do not have this luxury. They've been alienated from their families, but they deserve our support. And that's why, along with Mr. Kerry, we've introduced the CONNECT Act, which would amend the statutory purposes of the Chafee program to establish helping youth create meaningful connections with adults and build a lifelong support network as a purpose of the Chafee program. I still have a relationship with the couple that intervened in my life when I was 18, and I just had a birthday. I'm 75. It clarifies that Chafee funds can be used to help youth be partners in their permanency process and to facilitate and support peer support, mentoring, family reunification, kinship families, and adoptive families. This bill also requires the Secretary of HHS to issue guidance regarding implementation of the new statutory purpose of the program, including facilitation of peer mentoring, outreach, and referrals to appropriate programs and services, and protocols for targeted support. Data doesn't lie. According to the Centers for Disease Control and Prevention, having at least one safe, stable, and nurturing relationship with the supportive adult dramatically reduces the negative impact of adverse childhood experiences, an example of which is being removed from your home and placed in foster care. Children with stable, nurturing relationships with trusted adults are better able to regulate their emotions, form other stable relationships, and far more likely to experience better academic and health outcomes. We owe it to these youth to help them take control of their own destiny, and we can start by helping them build the network they need to do so.